Together we achieve victory over heart failure.
Hello and welcome to our podcast on heart failure. I am Dr. Nitin Patki, interventional cardiologist from city of Pune. First of all, when we say heart failure, there is definitely no need to panic. Heart failure may mean to a person that heart has stopped working and the death is imminent, but that is not the meaning. The heart failure means capacity of the heart to work as a pump of the blood to supply various organs of the necessary blood supply is not being fulfilled. This is an eminently treatable and, more importantly, a preventable heart problem, and therefore don't panic. Now let's talk about few aspects of heart failure. So heart failure can happen commonly with capacity of the heart to pump the blood out is reduced. That is called as reduced ejection fraction. Or sometimes even when the heart is pumping well, that is ejection fraction is normal, still the heart failure can happen. Now this can happen because the heart is become little bit stiff and it cannot accommodate the blood which should come in the heart chamber. Now this differentiation is essential because the treatments will be different. In India, we see heart failure in younger age, about 10 years younger than the Western people. And the reasons are there is increased incidence of high blood pressure, that is hypertension, diabetes, that is uncontrolled sugars, and heart attack problems. In addition to our genetic susceptibility, which is basically because our genetic predisposition, we are more prone to get heart attacks, but also our bad lifestyle, which means no exercise, changed diet pattern, in smoking and use of tobacco, all these contribute to higher incidence of blood pressure, high blood pressure, diabetes, and heart attacks. And unfortunately, this is happening at younger age compared to Western population. Also, the people who actually need the treatment do not come forward with their complaints and reach the doctor so that diagnosis can be done and adequate treatment should be started. More importantly, the people who actually need treatment, very few will reach doctor, very few will be diagnosed properly, very few will be treated, and even those who are treated, not all will be on proper dosage what are required. Most commonly, the patients will present with breathlessness, that is shortness of breath, reduced work capacity. That means sometimes you were able to walk a certain distance, now you are not able to walk that distance, swelling over the feet, or because of reduced appetite, food intake is getting down. The commonest cardiac investigations what we do for such kind of complaints are ECG and echocardiography. All of us know that this is ultrasound of the heart, which tells us about the pumping capacity of the heart, which we technically call as ejection fraction. And as I mentioned, it can be heart failure with reduced pumping capacity or reduced ejection fraction, or heart failure with normal ejection fraction or the preserved ejection fraction. Additionally, echocardiography can give us other problems which are contributing or causing the heart failure, like valvular heart problems or congenital heart problems or previous heart attacks, or because blood pressure has caused some changes in the heart pumping. Additionally, we need some blood investigations. Commonly, this is called as natriuretic peptide levels, which help us diagnose the heart failure. But other tests like hemoglobin, kidney function, cholesterol, sugars, thyroid, other blood tests are also essential to treat the heart failure patient properly. How do we avoid heart failure? Most importantly, it is important to get your regular medical health checks done so that your high blood pressure and diabetes, which are most commonly asymptomatic, that means person will not get any symptoms related to high blood pressure or diabetes, but are running those problems, and these can be diagnosed with health checks. And conditions like heart attack can be diagnosed and treated properly. Most commonly, the patients of heart failure will present with breathlessness, reduced work capacity, swelling over the feet, or poor appetite. The common cardiac investigations are ECG and echocardiography. Echocardiography will tell us about the pumping capacity of the heart, which I told you about the heart failure with poor pumping, that is reduced ejection fraction, or if the heart is pumping properly but has features of heart failure. Also, the echocardiography will tell us about additional problems which are contributing to heart failure, like valvular heart problems or congenital heart problems or previous heart attack, or if there is any high blood pressure which has caused problems with the heart capacity. In addition, we need to do some blood tests which help us diagnose the patient as being a heart failure patient, and these are natriuretic peptide levels. Additionally, other blood investigations like hemoglobin, kidney function, cholesterol levels, sugars, or thyroid function, these are necessary to treat the heart failure patient properly. Now, how do we avoid getting heart failure? Regular medical health checks are essential because that is the only way we can diagnose high blood pressure or diabetes, as these being diseases with no symptoms. Many times you don't get these diagnosis with symptoms, and therefore these are called as silent killers. Additionally, regular medical health checks will give us diagnosis about obesity or possibility of getting a heart attack. It is important to continue medications in prescribed doses. Make sure that your blood pressure and diabetes are under well control with regular medical health checks, as you may think that the medicines once started will control the things properly for whole length of life. That does not happen. Regular exercises are essential not only to prevent heart failures, but also, even if you have heart failure, to have a good quality of life and good length of life, it is important to have regular aerobic exercises. Once diagnosed, there are highly effective medicines which are currently available, and also some medical devices which can be implanted with minor surgeries. And these have given a significant improvement in patients' cardiac condition. And recently, even heart transplant therapies, heart transplant surgeries are also available in our country in various cities. Finally, it is important that once you have diagnosis of heart failure, there is no need to panic. Regular health checks and taking proper treatment in proper doses is essential to prevent heart failure problem, and also even if you have heart failure problem, to have a good quality of life and good length of life. Patient can have a good quality and good length of life if he is taking good care, proper medications, regular medical health checkups, and doing regular exercises. Thank you.